All right, so administering inhaled medications and topical medications. In the med room, you're going to perform hand hygiene, you're going to retrieve the patient's MAR and retrieve the correct medications required by the MAR at this time. You're going to go over the 5 rights: right patient, right drug, right dose, right route, right time. You're going to discuss the nursing considerations for administering each of these medications. For inhaled medications, you're just going to want your inhaler. For topical medications, if it is an ointment, you can put some in a cup before going to the patient's room so you don't take the whole tube in and contaminate it. If it is anti-anginal, or such as nitro paste, you're going to get a new medication patch. You're going to take the tube of medication in. Make sure you have a pen and some tape. If it is a transdermal patch, you just want to take the new patch and make sure you have a pen and cleansing supplies if necessary. So once you've done all that, you're going to go to the patient's room, you knock, ask if you can come in. You're going to wash your hands and provide privacy. You're going to confirm that you have the right client by assessing their wristband, having them state their first and last name and their date of birth, and also scanning it. You're going to scan any medications needed, and you're going to discuss with the client their allergies. And then again, you're going to discuss the reason why you're administering each of these medications. So starting with inhaled medications, have some water on hand if needed. You're going to assist them to a high Fowler's position. If there's no spacer needed, again, you can have them do this if they know how to do this, but if not, you can talk them through it. So you're going to put on your procedure gloves. You are going to instruct them to take a deep breath, and then exhale fully. And then on the inhale, or exhale fully. On the inhale, once they start to inhale, you're going to depress the canister. Before doing this, you're going to shake the canister to activate the inhaler, the powder in the inhaler. Before administering it, you're going to have them take a deep breath, exhale fully, and then on the inhale, you're going to depress the canister and have them inhale fully. At the end, you're going to have them hold their breath for 10 seconds, and then exhale slowly, either through their nose or through pursed lips. That's if the inhaler does not have a spacer on it. If it does have a spacer on it, you're going to, again, have them exhale fully, have them inhale fully for 5 seconds while you're depressing the canister, or they can take 2 to 3 small breaths just to get all of the medication out of the spacer. And again, exhaling slowly through their nose or pursed lips. You're going to wait 1 minute between inhaled medication dosage or different medications. You're always going to administer a bronchodilator before any other inhaled medications. And if it is a steroid, you're going to have them rinse their mouth afterwards due to thrush. After administering it, you take the inhaler back, remove your gloves, and document on the MAR the medication given. If it is a topical medication, again, you're going to want to discuss the patient's allergy and discuss the reasons for administering this medication. You're going to, again, perform hand hygiene. You're going to don new procedure gloves. If it is a cream or an ointment, say we brought it in a cup, you're going to first assess the client's skin, the affected area, make sure it's doing okay. You're going to cleanse it as needed. If it's a cream or an ointment, you're going to take it and soften it in the hands, and then you would apply it to the patient's skin, and then you would document on the MAR the medication and the location it was administered. If it is an anti-anginal, such as a nitro paste, you're going to take the new patch, you're going to date, time, and initial it, turn it upside down. You're going to take the old patch off, You would cleanse and assess the areas needed. You're going to rotate sites though, so we're going to find a new site that is clean and smooth. So after you've time, date, and initial date, you're going to take the nitro paste and apply the correct dose along a measurement line on the patch, and then you're going to place it on the new area and use hypoallergenic tape to secure it. If it is a transdermal patch, you are going to locate the old one, you're going to take it off, you're going to fold it in half and put it in the sharps container. You are going to date and time and initial the outer side of the patch. You're going to again assess the client's skin, cleanse as needed. Again, I would rotate sites for putting this patch, so you're going to find a new clean, smooth location. You're going to peel and apply the patch, making sure there's proper adhesion, and then you would take off your gloves and document on the MAR the medication and where it was administered.